Good day, class. In this video, we are going to talk about the heart, including the pericardium. The heart is one of the most important organs in Zangfu theory. Although the theory based on the 5 Zang organs, the heart is similar to the emperor, which is the center of the country, the center of the human health. The orifice of the heart is on the tongue. So we can see from the manifestation of the tongue to indicate the heart's situation. The heart also linked to the brain. The heart governs the blood. The heart governs the mind. So the dysfunction of the heart, the patient may present as different symptoms or different situation that's in the category of the mind or the blood. For example, the mental disorder, the emotion, even the menopause. Anything related to the mind, to the psychological activities, to the emotions. When you see these kinds of patients, you may think about the heart, because the heart controls the mind. The second, the heart governs the blood. The heart needs to create the heart. How does the heart create the blood? As described in the classic, we have mentioned quite a few times. The middle jaw receives the qi. The qi is transported to the heart, and then the heart change or transform the qi into red color. The red color of qi we call the blood. So when you understand this process, if a patient suffers from blood deficiency, you also can focus on the heart. A patient suffers from blood deficiency, the patient may present as pale, something pale tongue, pale facial complexion, or dizziness. The heart governs the blood. The heart also needs to promote the circulation, to promote or to limit the blood within vessels. That's the function from the heart, governs the blood and governs the vessels, to limit the blood move within the vessels. So if this function is affected, the patient may present as bleeding, different kinds of bleeding, or vomiting, nose bleeding, or bleeding under the skin, like wounds. The hearts, including the physical heart in the anatomy, also the disease will include the medical conditions that are related to the heart, related to the blood. Patient may present as palpitation, poor memory, insomnia, unconsciousness, or mental disorder. The heart meridian and the small intestine meridian are coupled meridian, or in other words, the heart and the small intestine are coupled organs. The pericardium and the Sanjiao meridian and organs are coupled meridians and organs. The foot Tai Yin meridian linked to the heart. The foot Shao Yin meridian also linked to the heart. The 3 foot Yin meridians link to the pericardium. The foot Jue Yin meridian distributes to Tanzhong in the chest. The foot Yang meridian directly linked, not the meridian, but the branches of the meridian directly linked to the heart. The Du meridian linked with the heart through the brain. As we mentioned previously, the heart links to the brain. The hand Shao Yin meridian linked to the lung. So as you can see from the connections, the heart and the pericardial meridian, the heart and the pericardial diseases can affect the small intestine, 三焦, the lung, the spleen, the liver, the kidney, and other yang meridians, especially the foot yang meridians, 2 meridians. So we can see quite a big range of different kinds of conditions from the heart. The heart qi deficiency. When we see the heart qi deficiency, firstly we need to identify this is a deficient syndrome. Deficiency syndrome, especially the qi deficiency syndrome, the patient may present as pale complexion, palpitation, short of breath, spontaneous sweating, fatigue. And this fatigue will be worse after exercise or after working. Pale tongue, white coating. It can be thin white coating. It also can be thick white coating. The pulse must be weak and forceless, and sometimes even irregular pulse. The patient may present as cold lumps. Extreme sweating. These are all due to qi deficiency. Once the qi deficiency develops into a next stage, in a more severe condition, you become yang depleted or yin depleted. The patient may present as extreme sweating, sweat a lot. In the treatment principles, we need to warm the heart, harmonize the heart qi and blood. So warm the heart yang. The yang refers to the yang qi. In the treatments, we're going to use a combination of acupuncture and moxibustion. Focus on the reinforcing technique. Many focus on the hand Shaoyin meridian and hand Jueyin meridian. These 2 meridians are directly linked to the organs. We also can use the back shu points. As we mentioned previously, the back shu points are mostly used for deficiency. Sometimes we also can use the lung points, the front mu points. The front mu points can be used for reducing, but because of some situations, some symptoms, although this is a deficiency syndrome, some emergency, some acute stage, we also can use the aligned points, such as the common points we use: heart 7, heart 5, pericardium 6, rung 17, bladder 15, bladder 14, stomach 36. Apart from these points about the category of these points, apart from the meridian, some of these points are also the connecting points. That's why we use quite often. And the second one, the heart blood deficiency. The blood deficiency, the patient may present as pale because of no enough blood. The patient may present still can be pale complexion. The patient may feel palpitation, poor memory, insomnia with a lot of dreams. When we see the heart blood deficiency or even heart yin deficiency, as you can see in acupuncture, we don't actually differentiate that clear as the internal medicine in the diagnostics. A heart blood deficiency and heart yin deficiency, the patient may present as insomnia and a lot of dreams during sleep. So what's the reason? How to analyze, explain this phenomenon? While a patient suffers from the heart blood deficiency, will present as insomnia. So this is something I want you to think about. You may find the answers in the basic theory when we explain the heart spirit, the heart yin and heart yang. The patient also may present as the feverish sensation in the palms or under the soles, night sweat, pale tongue with less saliva, firm, weak pulse, or irregular pulse. As you can see here, this description, these symptoms, actually not only heart blood deficiency, these descriptions includes the heart yin deficiency. Why we put these symptoms together? The reason is because in the treatments, no matter heart blood deficiency or heart yin deficiency, we may use similar treatments. And blood is also in the yin category. The treatment principles begin to tonify the qi and nourish the blood to calm the spirit. Begin to use the combination of acupuncture and Moxibustion, reinforcing technique. If due to the deficiency heat, yin deficiency with deficiency heat, then we use even manipulation technique. We can use kidney 3, spleen 6, bladder 20, bladder 17. Why we use bladder 17? Bladder 20, 皮枢, is the back-sue point for the spleen. The blood, where does the blood come from? We always say the middle jaw receives the qi. The qi is transported to the heart and transformed into the red color. The middle jaw is very important. It's where the source of the qi comes from. So that's why we will use bladder 20, 皮枢, to strengthen the spleen function in order to assist the heart. 三阴交, also on the spleen meridian. As you can see now, we are treating the heart problem from the spleen. Although it's bladder 20 is on bladder meridian, it is specifically for the spleen, 皮枢. Bladder 17, why we use bladder 17? 膈腧. 膈腧 is the meeting point of the blood. Blood meet on bladder 17. In the heart fire or heart heat syndrome, the patient may present as the hot sensation in the chest. Still, the patient may present as insomnia, dream disturbed sleeping, thirsty. The patient also may suffer from ulcers, especially the ulcers on the tongue, because the tongue is the orifice of the heart. So when we're talking about the ulcers, the mouth ulcers, the ulcers in the mouth, or on the gums, in other region in the mouth, we're going to identify the location, and then we can link to different organs. If the ulcers in the upper gum, it will be the stomach, because the stomach meridian link to the upper gum. If the ulcers is in the lower gum, it will be the large intestine. So the ulcers on the tongue is the heart. The patient may present as vomiting blood, nose bleeding, scanty urine, especially with yellow or slightly pink color, blood in the urine. The patient also may present as ulcers on the skin, a red tongue, rapid pulse. As you can see from these symptoms, all these are related to the heat because of the characteristics of the fire. The flame moving upwards. The fire, the heat can burn the muscles. Once the muscles are burned, you become the ulcers, and it depends on individual location. Once the fire burns something, it becomes ulcers. Once the fire, the heat promotes the circulation. If the blood moves too quick, the blood will move out of the vessels, then it becomes bleeding. These are all the characteristics of the fire or the heat. In the treatment, we're going to clear the heat. We're going to use acupuncture. We don't use Moxibustion. We use reducing technique. Many focus on the hand Sao-Yin meridian, foot Sao-Yin meridian, and hand Jue-Yin meridian. As you can see, in the heat symptoms, we're going to focus on the Yin meridians. The Yin meridians can relieve the heat. The heat is yang. So we can use pericardium 6, heart 8, pericardium 7, pericardium 8, pericardium 6, pericardium 4, kidney 3, kidney 6. Especially the kidney 3 and kidney 6, the two are very important for yin, especially yin deficiency. So the heat, we also can nourish yin, because once you create the yin, the heat will be reduced. The phlegm mixing the heart mind. In this situation, the patient will present as the phlegm as well as something related to the mind. So the patient may present as insomnia, irritation, mental disorder, unconsciousness, poor memory, emotional disorder, or madness. The patient also may present as the noise from the phlegm, especially the noise in the chest. You can hear a lot of phlegm in the chest. The patient will present as a red tongue, greasy coating, watery and slippery pulse. This situation, in the medical conditions, we can see patients such as the mental disorder or after stroke, especially in the acute stage. In the treatments, we can use some technique to clear the phlegm and calm the mind. We're going to use acupuncture without Moxibustion, reducing technique, or sometimes we also can use the 3-edge needle to prick for bleeding, to cause bleeding. We're going to focus on the hand Sao-Yin meridian, hand Jue-Yin meridian, and Du meridian, such as heart 7, heart 9, pericardium 9, pericardium 6, pericardium 7, pericardium 5, Ren 26, Ju 14, large intestine 4, level 3, stomach 40, and the 12 Jingwei points. Stomach 40, Fenglong, we have mentioned quite a few times. Those points can be used for clearing phlegm. Large intestine 4 and liver 3, we always combine together to activate the circulation. So these two can be used as a pair, large intestine 4 and kidney 3. Ren 26. Ren 26 is very important for stroke, for mental disorder, for diseases that are related to consciousness. Du 14, Da Zui, is very important for the heat. Blockage of the heart vessels. Once the blood vessels has been blocked, the patient may present as pain. That's what we said. Wherever there's a pain, So wherever there's blockage, there's a pain. Wherever there's lack of nourishment, there's a pain. So these are the two different categories of pain. When we're talking about the blockage of the heart vessels, the patient may present as chest oppressed, palpitation, chest pain, and this pain sometimes can radiate to the arm. It also may radiate to the back. The patient may present as severe sweating, fever, cold extremities, purple lips, purple tongue, or sometimes with some purple spots on the tongue. Surgery pulse, irregular pulse, all may present in this situation. In the treatments, we're going to activate the blood circulation, removing the blood stasis, stopping pain, and block the meridian. Stopping pain is very important in this situation. As you can see, that from the descriptions that we describe, this situation very commonly seen in the heart attack. When we study the heart attack, we got different type of heart attacks. So heart attack is not a proper diagnosis. In the treatments, we have to stop the pain to relieve the pain. That's one of the most important aspects during this treatment. Blockage of the heart vessels. We're going to focus on the hand Shao-yin meridian, the hand Jue-yin meridian, and the back Su points and along points. Heart 7, Heart 6, pericardium 6, pericardium 4, rung 17, rung 14. Heart 15, Heart 14, Heart 17. Some of these points are the local points in the local area. That's why we choose these, and some of these points are either related to the blood, the meeting point of the blood, the location that's focused on the heart, on the back, or some specific function from that point. The small intestine links to the heart. It is a coupled organ of the heart. The small intestine also belongs to the digestive system. So the function or the presentations of the small intestine diseases mainly focus on the diseases that's related to the digestive system, although it also can relate to the heart, the spleen, stomach, and large intestine. The small intestine deficiency coldness. From this syndrome, we will see that the coldness deficiency. From the coldness, we will see that the patient may present as cold sensation. Apart from the cold sensation, more commonly, the patient may present as diarrhea, loose stool, or the noise in the abdomen. The patient also may present as frequent urination due to the coldness. The coldness will not consume the water, so the patient will have excess fluid. This is different to the heat condition. In a heat condition, the patient will have scanty urine, but in a cold situation, especially in a deficient cold situation, the patient may present as frequent urination. Once, because of the coldness that doesn't consume the water. So in the body, you will have excess fluid. The second is because the coldness, the combination of the coldness and deficient, especially when we talk about the qi deficiency, the qi deficiency will lose the control or will lose the function of the confining function. That's also another reason for the frequent urination. Because of the coldness in the small intestine, in the local area, the patient also may present as cold sensation in the lower abdomen. Pale tongue, white coating, thin weak pulse, or deep slow pulse. The treatment principles: we're going to warm the intestine, expel the coldness, regulate the qi, stopping the pain. When you see the warming, reinforcing, you always need to think about Moxibustion. So in the treatments, we're going to use the combination of acupuncture and Moxibustion. Reinforcing technique, we're going to focus on the foot Yangming meridian and the related back shu points and along points. Yangming meridian. The foot Yangming meridian is the stomach meridian. It is directly linked to the digestive system. The Yangming meridian, also a meridian that has plenty of qi and blood. That's why we focus on the foot Yangming meridian. Stomach 36, stomach 39. Stomach 39 is the low C points of the small intestine. Stomach 25, stomach 12, room 4. These three are local points. So these local points can treat the local diseases. Bladder 20, 脾腧. Bladder 21, 胃腧. Bladder 27, 小肠腧. These are the back shu points that's related to the spleen, stomach, and small intestine. Small intestine excess heat. This is another very different situation. Due to the heat, the patient may present as irritation, thirsty, ulcers in the tongue, scanty urine, or even blood in the urine. Sometimes the patient may feel pain while urination. The heaviness sensation in the lower abdomen, especially the distending sensation in the lower abdomen. That's because of the heat. The heat can expand, so the patient may suffer from the distending sensation. And this kind of pain, distending pain, can be relieved after the bowel movements or after the air in the releasing air from the abdomen. Red tongue, yellow coating, slippery and rapid pulse. In treatment principles, we can clear the heat, promote urination, especially if the patient suffers from painful urination. We can use acupuncture without Moxibustion, reducing technique. We're going to focus on the foot and the hand Shaoyin meridians, such as heart 5, heart 7, heart 6, kidney 3, kidney 6, kidney 1, small intestine 7, spleen 6, room 4, stomach 39. The last common syndrome in the small intestine is qi stagnation. Qi stagnation can be due to different causes, such as the internal coldness or other diseases. The patient may present as pain because of the stagnation. There's some blockage in somewhere, especially if presents in the intestine. The patient may present as the pain in the abdomen. In the treatments, we're going to use the combination of acupuncture and Moxibustion, reducing technique. Focus on the Rome meridian, foot Yangming meridian, and foot Zhuyin meridian. Room 4, room 6, level 3, level 1. summer 29, summer 36, and 39. In this video, we have introduced the common manifestations as well as the human principle and the common points that's commonly used in the heart and small intestine related diseases. In the next video, we are going to talk about the kidney and the bladder. Thank you for your attention.